What if I told you that your diet might actually help prevent BPH? I'm Dr. Rena Malik, urologist and pelvic surgeon, and today we're going to talk about what changes you can make within your diet to help prevent prostate enlargement. Now, benign prostatic hyperplasia, or BPH, is a condition where the prostate becomes enlarged, and the prostate gland is located underneath the bladder and around the urethra. As it enlarges, it makes it more difficult for urine to pass through, leading to symptoms like difficulty urinating, straining, waiting for your stream to start, having a stop and start stream, splitting stream, and even sometimes having to go multiple times throughout the day or at night, and going very urgently, and sometimes even leaking urine. And BPH is incredibly common. It's estimated that over 50% of men over the age of 50 have some degree of BPH, and that number continues to increase to about 80% by the time men reach their 80s. And today we're going to talk about how your diet can affect BPH and how adding these few things to your diet might decrease your risk of BPH by almost 30%. So there's been two major studies that have looked at large populations of men to look at what dietary changes might be associated with BPH. And the important thing here to realize is that these studies are observational, meaning that you can see that these people who ate these things were less likely to get BPH, but we can't definitively say that this causes or prevents BPH. So the first study I'm going to talk about is called the Prostate Cancer Prevention Trial. And this was a study that included 4,770 men from the placebo arm of the Prostate Cancer Prevention Trial, also known as PCPT. Now, this was a randomized controlled trial that was initially designed to evaluate the risk of prostate cancer in men taking a medication called finasteride, in men who are younger than 55, and they followed these men for 7 years. Now, of that initial study, they looked at men specifically who didn't have BPH at the start of this study, so at the beginning of that 7-year time period, and they looked at how they changed over time. And so that left them with almost 5,000 men. And how they studied these guys is they completed a diet and supplement questionnaire, as well as food frequency questionnaires, looking at 99 different foods they were taking in food groups, as well as 9 beverages. And they calculated then what's called the relative hazard or risk of getting BPH after controlling for how old they were, what their race and ethnicity was, how obese they were, and what kind of energy expenditure they made usually, as well as their other health conditions. So number one thing is increase in protein intake. So in this study, they found that higher protein intake decreased BPH risk by 15%. Now you might say, how much higher? Well, they looked at the total energy percentage of what you're eating. If you were eating a 2,000 calorie diet, what percent of those calories were coming from protein? Men who had more than 19.5% of their total energy from protein versus less than 14.6% of their total energy had a decreased risk of 15%. Now, if you looked at the number of calories, if 490 calories or more were taken from protein versus less than 236, that decreased the risk by 33%. Now, the average person in the US gets about 13 to 16% of their daily intake through protein. So you need to be a little higher than average to reach that 19% mark. Are you struggling to get enough protein? Well, I want to share with you guys this amazing new protein bar called David Protein. And I can't tell you that I'm so excited to be partnering with David Protein because I actually use this bar myself. I've been looking for something that will help me reach my goals, which right now is to increase strength and to lose weight, which means I need to increase my protein intake, but keep my calorie intake low. And that's exactly what David Protein does, which is one of these bars, I get 28 grams of protein for just 150 calories. Now, you guys might not know this, but when you're looking at all these high protein products, if you turn them over and look at the nutrition label, oftentimes they may have 15 or 20 grams of protein, but their calories are significantly higher. And so what ends up happening is that you're eating a lot more calories than you need to get the amount of protein you need. It's just the least calories for the most protein ever. And even better, it tastes really good. My personal favorite is this blueberry pie flavor. It's also available in chocolate chip cookie dough, cake batter, double fudge brownie, blueberry pie, as I mentioned, and coming soon, peanut butter chocolate chunk and salted peanut butter, which I'm so excited about because I love peanut butter. The other great thing about this is that most protein bars, they leave you with that chalky, nasty taste, but this one actually tastes really good. And so when I'm on the go, like I'm in between podcast interviews or in between patients, I can grab a David bar so I'm not famished and I'm actually feeling more satiated, so I don't go and grab some high sugar piece of chocolate from the nurse's station. I can actually focus on meeting my goals, eating healthy, and still enjoying it. If you want to try it, go to www.davidprotein.com/Dr. Malik. You can order a sample pack, or if you want to order 4 cartons, you get the 5th one free. So check it out and let me know what you think. All right, number 2, decrease in fat and maybe red meat intake. So in that same study, the PCPT study, it showed that a diet high in total fat and red meat was associated with an increased risk of BPH. Let's talk about the red meat thing. You can't differentiate people who are eating lean red meats from high fatty red meats. So I assume that likely a lot of the high red meat issue is coming from high fatty red meats, but they couldn't differentiate from that, so I can't say specifically. But when you look at the data, when you compare men who ate daily consumption of red meat, meaning every single day, versus less than once a week, they increased their risk by 38%. But when you look at the consumption between 1 to 7 times a week, there was no significant increase in risk. So all I can tell you based on this data is don't eat it 7 times a week, meaning don't eat it every single day. Ideally, I would recommend eating lean red meats because we do know that, again, fat is associated with BPH. So let me tell you the data on that. When you look at diets high in fat, they increase the BPH risk by 31%, meaning those who ate about 38% of their calories came from fat were 38% more likely to get BPH than those that had less than 25% of their calories from fat. Now, why is fat such a problem? Well, the reason behind this is that diets that are high in fat may potentially promote inflammation and cause hormonal changes that then drive prostate cell growth. And not only are they causing inflammation, but they may be causing hypoxia and tissue remodeling, meaning they may actually reduce the oxygen in the prostate and cause this remodeling and enlargement. Our next one comes from a different study, and this study is called the Health Professionals Follow-Up Study. Now, in this study, they looked at over 32,000 men who were health professionals, doctors, dentists, veterinarians, pharmacists, and they collected some baseline data in 1986 using sort of a semi-quantitative food frequency questionnaire. And they wanted to look if they consumed any of over 131 food items, as well as looking at what vitamins and supplements they took. Then they followed them from 1992 to 2000. So these men were followed for a long time, and they wanted to see if they had any symptoms or surgery related to BPH, and what were the odds of developing BPH based on these dietary factors. And again, they controlled for age, body mass index, smoking, alcohol, and in this case, protein intake, energy intake, and polyunsaturated fat intake. So that brings us to number 3, which is increasing your vegetable intake. So in this study, they found a 32% decreased risk in men who consumed 6 or more servings of vegetables per day compared to less than 1.6 servings. And in particular, they found that fruits and vegetables that were rich in beta-carotene, lutein, and vitamin C reduced the odds of BPH by anywhere from 11 to 17%. Now, you may be thinking vitamin C, I can take that as a supplement. However, they did look at vitamin C in foods versus vitamin C in supplements, and they didn't see the same impact when taking vitamin C in a supplement form. Specifically, when you're looking for foods that are rich in lutein or beta-carotene, you want to look for things like cooked spinach, raw spinach, peas, Brussels sprouts, and peaches. Also, things like oranges, grapefruit, or fresh orange juice or grapefruit juice was also seen to be beneficial. Legumes like string beans, peas, beans, and alfalfa sprouts were shown to be beneficial. And cruciferous vegetables like broccoli, sauerkraut, coleslaw, cooked cabbage, cauliflower, again, Brussels sprouts, kale, all those things were shown to be, again, beneficial for potentially preventing or having a lower odds of BPH. Other vegetables were things like corn, mixed vegetables, mushrooms, yams, iceberg lettuce, romaine lettuce, and garlic. So a lot of vegetables. And so a lot of them were associated with a lower odds of getting BPH. Number 4 is zinc intake. Now, not from a supplement. In fact, zinc supplements didn't show a difference, but higher dietary zinc was linked to a reduced risk of BPH, with men taking more than 18.9 milligrams per day having a 32% lower risk compared to men taking 8.8 milligrams or less. So you might be wondering what kind of foods have zinc in them. Well, first off, oysters. 2 oysters contain almost 12 milligrams of zinc. Pumpkin seeds. 100 grams of pumpkin seeds contains almost 8 milligrams of zinc. So 100 grams of beef contains almost 5 milligrams of zinc. And almonds, 100 gram serving of almonds contains almost 4 milligrams of zinc. And other sources can be things like hemp seeds, chickpeas, lentils, sunflower seeds, or chia seed. Which leads us to our last item, which is flax seeds or flaxseed extract. So in a small study of 87 men, they found that flaxseed and its active component, psychoisolycerus diglycoside, I don't know if I'm saying that correctly, can help reduce the risk and symptoms of BPH. So in this study was a randomized double-blind placebo-controlled trial where they administered either placebo, 300 milligrams or 600 milligrams per day of the flaxseed extract containing that SDG to 87 men and followed them for 4 months. And after 4 months, they saw that their score of urinary symptoms called the IPSS, as well as their quality of life scores improved. So they noticed that their symptoms went from moderate to severe to mild. And while that may not seem like a big deal to you, I would say a lot of patients would love to go from moderate to severe symptoms to mild without having to undergo surgery or other procedures. Now, this is a very small study. It's only covered 4 months, but it may be helpful in some patients. Bottom line, I think there's so much that we can do for our health to improve our quality of life and hopefully prevent chronic conditions like BPH. I hope there's more investigation into this area of prevention because I think it's so important. With 80% of 80-year-olds dealing with BPH, I mean, it's really important for us to try and find ways to prevent it. If you guys enjoyed this content, make sure to check out my podcast. It's here on YouTube, but you can also find it wherever you listen to podcasts, whether it's Apple Podcasts, Spotify, or any other application. It's the Rena Malik MD podcast because sometimes, let's face it, you don't have the time to watch a video, but you can always put your earbuds in, go for a walk, or listen to it in the car and hear a podcast and learn something that's going to help your life and help you feel better, have better sex, and overall live a better life. So as always, remember to take care of yourself because you're worth it.